Namaste, welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing about the Varnya Karma and we have discussed the main disease where the Varnya Karma is needed and the skin is a dushya and it is called as Kushta. We are discussing some karma or some disease here, just understand I am pinpointing the main points of the Samprati and its clinical application. About Hetus, Rup, Purvaru, it is expected that you can go through the text as it is very easy for understanding. Main principle of thinking of that disease, its clinical application, we are discussing here. So after discussing Kushtha, where the skin is a major part of the body which is affected, the another disease where skin is affected is Shvitra, leukoderma, or where there is white patches occur on the skin. In the text, they have mentioned in Samprati the same dosha dushya present in the Shvitra, but difference is Shvitra is aparistravi. There is no secretion or any oozing from the skin lesions. In practice, what we see in the patients that there is a normal coloration of the skin and there are some white patches on the body. The number of the white patches may vary. It may be restricted to some parts or they may be seen on the many parts of the body. Now what happens here, see, here is say normal skin and this the circle which I have drawn is a white patch. Now what is the difference? The color of the skin outside this patch is normal and this patch is completely white, and now this white patch we can describe as a Shvitra, and you have to make the color of that patch again normal. Now in this case we have to make the color as normal, and that's why we have to think of the Rakta Dhatu mainly, because they have given in the text there is sometimes itching etc., but in practice I have rarely seen itching or burning or any other complaint. There is a plain white patch present on the skin. So Rakta Dhatu is the main dhatu responsible for the Varnya Karma, and hence you to make this patch again the normal color, the supply of Rakta Dhatu here should be increased. Now what is the choice? First, some applications on that patch, and another good choice is Jalokavacharan. How it works? You know, Jaloka get the blood absorbed. So if you apply Jaloka in the center of this patch, they, because of their nature, they suck the blood from all around the area, and hence the blood supply of that area gets increased. Of course, for this the quality of Rakta Dhatu should be proper, and you have to give Rakta Shuddhika Chikitsa also from this point of view. The another good application for the Shvitra is the drugs Dravya like Chitra. In last episode I mentioned you that definitions of diseases or any other thing contribute in our knowledge, and we can assume its clinical application by that definition also. Dravya like Chitra, the definition of the word Chitra means designs, like that. The chitraka means which when applied on the skin gives different color to the skin. Chitrak is tikshna ushna, and when you applied that chitrak on the skin, it creates inflammation and redness and gives redness to the skin. Now there is white patch on the skin, and the dravya like chitrak are responsible to create redness on the skin. That's why name chitraka has been formed. So we can apply this dravya like chitrak on the skin. For Ratta Shuddhika purpose, internal medicine, what we have mentioned in the Kushtha, the same principle remains. Reduce Rattagat Kleda, increase the purity of the Ratta, and along with the purity, please increase the blood supply of this area. You can have Vidya Karma also, which will penetrate the skin, and when the blood comes out of this with the spots, automatically the blood supply of this area is increased. So Kushta and Shvitra are mentioned in the same Adhyay, specify Ashtanga Hruday. They have mentioned that all the Ratta Mamsa Stika are the same Tvacha are infected in this, in fact not infected, they are involved in this Samprapti, but in its practice, the picture of the skin lesions in the Kushtha is far more different than picture of the lesions in the Shvitra. In both these diseases, another factor you must consider is Krumi. In the Lakshana of Krumi, they have mentioned Varnya. Hence, Krumina Chikitsa should also be incorporated along with the proper Chikitsa of Kushtha or Shvitra. In Shvitra, like Chitra, Bakuchi, Karanja, Sahachar, which are Tishna Ushna Guna Dravyas, can also be used internally as well as for the application. In this Shvitra Vyadi, they have mentioned that it is where it is Sadhya or Asadhya, but and they have given the characters which is Sadhyavan and appear on the this forearms etc. is Asadhya. But in practice, we observe Shitra as a little bit difficult to treat, and it is a chronic one, and it takes much more time to cure also. But we can definitely reduce the extent of the Shvitra. Then if it is spreading to other parts of the body, it can be stopped, and by Jalogavacharan or Vidya Karma or procedure like scraping, we can help the patient very fast also. So these are the main diseases, Kushtha and Shvitra, where skin is affected at much more extent, and patients are very concerned with these diseases because socially also it is very difficult for them to carry these diseases in the routine life. Again, the principle remains same. The Rattagat Kleda should be reduced. Ratta purification, Ratta Shuddhikara Chikitsa should be the main line of treatment along with the Kurmigna Chikitsa, because Kurmi is one of the reasons for the skin lesions. And in Shvitra, in addition, you have to apply the dravyas which will create redness or give redness to the skin. So these are the two main diseases which are commonly observed in our practice, and you have to deal with them. In both the diseases, in my experience, Ratta Mokshan gives a good result, as Ratta Dhatu is responsible mainly for the Varnya Karma. Hope you have understood the basic clinical application in this Varnya karma. In next episode, we will discuss other conditions where Varna is affected and their clinical application. Thank you very much.